Okay, this is Chapter 4 of ATI Community Assessment, Education, and Program Planning. The role of the community health nurse in community health program planning and evaluation is a collaborative leadership role. The desired outcome is the improved health of the community through the role and functions of the community health nurse. Community health nurses regularly provide health education in order to promote, maintain, and restore the health of populations. This is accomplished through a variety of means, such as community education programs. The nurse can use program planning to promote healthy communities in which community members partner with the nurse to address significant health issues. Community health program planning should reflect the priorities set as a result of analysis of community assessment data. Priorities are established based on the extent of the problem, which is community members' perception of health needs, percent of population affected by the problem. The relevance of the problem to the public, which is degree of risk, economic loss, and the estimated effect of intervention, which is the improvement of health outcome, adverse effects. Community health nurse roles. The community health nurse is a key player in assessing the needs of the community, interacting and establishing contracts with community partners, serving the community at large, witnessing the interaction between community programs and the responses of the client to the services, identifying future services based upon the visible needs of community members and population groups. Community assessment, individual, family, and aggregates. Community assessment is a comprehensive approach that emphasizes the community as a client with the goal of providing benefit to the people of the area as a whole, rather than to individuals. Community assessment and diagnosis are the foundation for community-specific program planning. Using the nursing process, nurses can determine health needs within the community and assist in developing and implementing strategies to meet those needs. In doing this, it is necessary to expand the assessment, diagnosis, planning, intervention, and evaluation efforts from the individual to the community or aggregate level. To guide community interventions, nurses can conduct an assessment to identify the community's needs or strengths. Community assessment begins with defining the community to be studied. The community can be those in a shared place, which is a geographic community, those with a shared characteristic, which is demographic group, or with a common interest, which is a functional community. Ecological model. An ecological model for population health can be used as a guide to examine the detriments of health for a population and for targeting interventions to multiple factors that affect health. It includes the following components: individual traits like age, gender, biological, mental, and behavioral factors, social, family, and community relationships, occupation and home environments, overall conditions created by local, state, national, and worldwide forces. Factors to consider: status, structure, and process. Status is epidemiological data, client satisfaction, and mental health crime rates. Structure is presence of healthcare facilities, service types and patterns of use, and demographic data. Process is relationship communication, commitment to, and participation in health. Community assessment components: people, demographic, distribution, mobility, density, and census data. Biological factors: health and disease status, genetic. Social factors is occupation, activities, marital status, education, income, crime rates. Cultural factors is ethnic groups, hierarchy and roles, language, religion, and spirituality. Place or environment. Physical factors and environmental factors. So physical factors are geography, terrain, type of community, location of health services, housing, animal control. Environmental factors is geography, climate, floral, fauna, topography, toxic substances, vectors, and pollutants. Participant observation is observation of formal or informal community activities. Focus groups is directed talk, open-ended questions with a representative sample. Surveys is specific questions asked in a written format. Photo voice is photo elicitation by community members to understand health issues from a community member's perspective. Windshield survey is a method of simple observation and a descriptive approach that assesses several community components by driving through a community. Survey components for windshield is people, who's on the street, what's their general appearance. Place is boundaries, where is the community located, are there plants or animals that could harm or threaten the health of community. Housing is there acceptable quality, is the housing good in repair or disrepair. Social systems, are there social services, clinics, hospitals, dentists. Analysis of community data. The community health nurse plays an active role in assessment, data interpretation, and problem assessment. Data include the following: gathering collected data, identifying and generating missing data. Community health diagnosis. Problems identified by community assessments are often stated as community health diagnoses. Community nursing diagnosis incorporates information from the community assessment, general nursing knowledge, and the epidemiological concepts, especially the concept of risk and population. Community health education. In designing community education programs, nurses must consider the barriers that make learning difficult. Some of these obstacles include age, cultural barriers, poor reading and comprehension skills, language barriers, barriers to access, and lack of motivation. Effective community health education requires planning. So there's here are the learning theories: behavioral theory, cognitive theory, critical theory, developmental theory, humanistic theory, and social learning theory. So behavioral theory is use of reinforcement methods to change learners' behaviors. Cognitive theory is the use of sensory input and repetition to change learners' patterns of thought, thereby changing behaviors. Critical theory is use of ongoing discussion and inquiry to increase learners' depth of knowledge, thereby changing thinking and behaviors. Developmental theory is use of techniques specific to learners' developmental stages to determine readiness to learn and to impact knowledge. Humanistic theory assists learners to grow by emphasizing emotions and relationships and believing that free choice will prompt actions that are in their own best interest. And social learning theory links information to beliefs and values to change or shift the learner's expectation. So there's 3 learning styles. Community health nurses enhance the provision of education by addressing learning styles and domains of learning. So there's visual learners, auditory learners, and tactile kinesthetic learners. Visual learners learn through seeing and methods such as note-taking, video viewing, and presentations. These learners think in pictures. Auditory learners learn through listening and methods such as verbal lectures, discussions, and reading aloud. These learners interpret meaning while listening. Tactile kinesthetic learners learn through doing and methods such as trial and error, hands-on approaches, and return demonstration. These learners gain meaning through exploration. Domains of learning. There's cognitive domain, affective domain, and psychomotor domain. Cognitive domain involves knowledge and the development of intellectual skills. For example, a client discusses how sodium intake will affect blood pressure. Affective domain involves a change in attitude and development of values. For example, a client expresses acceptance of having a colostomy, and it maintains self-esteem. Psychomotor domain involves the performance of a skill. For example, the community nurse teaches a client how to self-administer insulin. Development of a community health education plan. First, identify population-specific learning needs. Consider population-specific concerns and effects of health needs on the population. Select aspects of learning theories. Identify barriers to learning and learning skills. Design the educational program. Implement the education program. Evaluate the achievement of learning objectives and the effectiveness of instruction. Pre-planning is brainstorm ideas. Assessment is collect subjective and objective data about the community and its members. Diagnosis is identify and prioritize health needs of the community. Planning is develop interventions to meet identified outcomes. Implementation is carry out the plan. Evaluation is examine the success of the interventions to determine if goals were met.